In terms of the benign breast conditions, pain, lumps, or a combination of painful lumps are the most common presentations of benign breast conditions. It's more like 90% of the benign conditions. Sometimes benign conditions can present with nipple discharge or sometimes nipple changes. The commonest benign breast conditions are benign thickening in the breast due to hormonal changes, cysts, or fibroadenomas. Also, sometimes some benign discharge from the nipple, especially in smokers. This is very rare, and it's not any of what I mentioned before in terms of the cyst or fibroadenomas or the benign thickening in the breast tissue, but there are very, very few conditions that actually can potentially lead to breast cancer in the future. This is, of course, need to be discussed with the surgeons and need to be examined in the clinic and assessed properly, and the patient will be advised regarding what condition can actually propose the patient to slightly higher risk of having breast cancer in the future. But none of the infection, none of the benign discharges, none of the benign fibroadenoma or cysts can actually make the patient prone to have a cancer in the future. So the understanding of how benign breast changes happen is actually part of the aging process of the breast. And as such, is actually very unlikely that we can prevent that, if you want, progression of the breast or the aging of the breast. So the ladies who have cysts, it's very unpredictable whether they would have more cysts in the future or less cysts in the future. I think the key point here is the lady to be breast aware and keep examine herself once every month at least, and try to, if any problems or issues, to take it to her GP or her breast surgeon. So breast pain is one of the benign conditions that ladies might have to live with. However, there are many things that we can do to relieve that pain. So, for example, the primary breast pain, or basically breast pain caused by hormonal changes, can be sometimes relieved by having the triple assessment, the patient to go and be reassured that what she's complaining of is actually nothing to worry about. Some studies show that stopping having a caffeine intake might actually improve that pain. And also sometimes having the evening primrose oil or safflower oil in ladies who are suffering from hormonal pain can actually be very helpful. In terms of the cyst, which can sometimes cause pain, whenever the lady feels the lump or the cyst, if she takes it to her breast specialist, aspiration of that cyst can also like relieve the pain. So yes, some of these conditions can be actually relieved. And definitely be reassured. The patient to be reassured is a very important factor in relieving some of these pain and discomfort. The priority in the clinic is to make sure we're not dealing with any suspicious or cancer. So what we do is we follow the triple assessment, which is the golden standard, and that is by doing the examination and the appropriate imaging and then appropriate tissue sampling if needed. Once we establish that what we're dealing with is a benign condition, then we reassure the ladies and we give them advice how to deal with these conditions. So for example, if this is a cyst, we give them like lifelong advice what they should do if such a cyst or lump appeared in the future. Similarly, if the main issue is pain or thickening in the breast tissue, we can go through the examination with the ladies, teach them how to examine themselves and also how to relieve the pain with simple like advices.